Good afternoon, everybody. Thank you for joining us again on our weekly COVID-19 briefing with Montgomery County Executive Mark Elridge, Dr. Travis Gales, our health officer, and also Dr. Earl Stoddard, who is the director of the Office of Emergency Management and Homeland Security for Montgomery County. I am Lorna Vigili, Hispanic Public Information Officer. I will be hosting this briefing today. And members of the media, you should already have permission to record. If you do not, please ask for it on the chat and use the chat later on for the Q&A portion of this presentation. With that, Mr. County Executive.
So I just want to welcome everybody and thank you for joining us again today. In a couple of days, I think we know that we're going to be acknowledging the one-year anniversary of the first cases in Montgomery County. If people remember, this started with 3 people who came back from a cruise in the Mediterranean and up the Nile River. And those were our first 3 cases. And now we are sitting here a year later. We've had 63,000 cases about 1,400 deaths. So the world has, radically changed since then. When we were doing things in the March and April timeframe, and we set out an economic recovery program, everybody thought this was going to be over in May or June. And when we were in, late May and June, we were talking about were we going to reopen for the 4th of July and have the 4th of July celebrations. And here we are a year later, not only no celebrations, but we still have limits in indoor and outdoor gatherings, and the virus is very much with us. But things are definitely improving, not as fast as people would like, but they're improving as fast as they can improve, because at the end of the day, our ability to vaccinate people depends on the ability of the pharmaceutical companies to provide vaccine. They, are all contracted with the federal government. The federal government is putting out vaccines pretty proportionately, so it's not that the federal government has favored children and unfavored children at this point. It just doesn't have enough doses, and those doses go to the state, and then the state apportions it down to the county level. So until there are more doses produced, we are going to continue to move slowly. The good news is that this week will be receiving our first doses of the Johnson & Johnson vaccine. I think it's about 1,600 doses. We're not sure whether that will be repeated next week or the week after that, but we do know as soon as their production's ramped up that we'll be seeing more of the Johnson & Johnson doses. We know that both Pfizer and Moderna have said that they're increasing the speed of their vaccine production. And so overall, over the next month or so, we should see a rapid increase in the supply of vaccine and our ability to get it out. I know there's been a lot of discussion about clinics and mass vaccination sites. We've been very clear that we're ready to do a mass vaccination site in Montgomery County. And if the governor, if they're having issues with logistics and the deployment of people to do that, all we need is the vaccines. If we're provided the vaccines, we will open up a mass vaccination site in the county. We're ready to do it. We've got a clinical partner, a hospital that will work with us. And so we're ready to go. We just need the doses to make that happen. But I do think, that the approval of the Johnson & Johnson vaccine moves us closer to a light at the end of the tunnel. I think people can begin to see that the vaccines and the doses are coming online. So far, we've vaccinated 161,000 residents in the county who've received their first dose, which is the most in the state, and nearly 80,000 residents have received their second dose. More than 15% of county residents have received both the first dose and almost 8 have received the first dose, and 8% have been fully vaccinated. And if you take out the young people, 17 and younger, which is approximately 22% of the population, the percentage of the eligible people in the county actually goes up substantially. A little over 70% of the estimated 73,000 Montgomery County residents who are older than 75 have received their first dose of vaccine. Again, the county was the only provider that was focused on making sure that these residents who were in the first public tier, as opposed to the employee tier of front-facing workers and healthcare workers, this is the first group that was targeted for vaccine, and we've gotten 70% through with our roughly 4,500 doses a week ration. Approximately 45% of the residents who are between the ages of 65 and 74 have also received their first doses, primarily from hospitals and pharmacies, and to some extent from the other mass vaccine sites around the state. Again, pointing out the state hasn't provided us with one directly in the county. And based on this progress, our county-run vaccination clinics are starting to vaccinate residents who are in the next tier of eligibility, which include essential workers, and we'll begin scheduling people who are pre-registered. So this will be coming very soon. We remain focused on equity, and last week we continued to distribute vaccines in areas of the county that have been hard hit by COVID cases. If you look at the census maps, you can see that while, the county has a good average, and we do well, in terms of positivity and number of cases per 100,000 at the state level. When you look at us as a county, when you look within the county, you see real serious disparities between parts of the county where the cases are very, very low, which means the chances of a person running into somebody in the course of, just being in your neighborhood who has COVID are pretty slim. But there are other parts of the county where the cases are much higher. Much of that is in communities that provide the workforce for the stores and the restaurants and the other places where everybody goes, which is meant to just try to underscore for people why the importance of vaccinating people where the number of cases are the greatest, because those are the folks who are most likely to have contact in the course of their jobs and their work with everybody else in the county. And that happens to overlay with the racial equity concerns that we've had, that statewide and nationally, people are not doing a really great job in terms of making sure that doses are being equally taken up by people of all ethnic and racial backgrounds. And so we've been working to make sure that the county does have a focus on making sure that everybody is getting access to the vaccines. That's why we've worked with community partners to bring that message in deeper in the community. And it's why we've set up, phone lines, multilingual phone lines, so people can call in and get information if you're having trouble or don't have the ability or access to a computer. Our health department stands ready to get more doses, and we're certainly ready to go beyond the capacity we have right now. And we've demonstrated again last week when we got 2 weeks worth of doses, those doses are all out. We have consistently been able to support the community in getting these doses there. I know how frustrated people are. I think people confuse when I say, or we say we have 15,000 doses. They think the county has them. They think the county controls the scheduling. The only schedule that the county can control is its own schedule. We've got people re-registered. We send out invitations to schedule for the 4,500 doses that we have. But the other 10,000 doses a week that are available right now are going out through hospitals and pharmacies that have their own scheduling system. I wish we had a unified scheduling system. We've raised this issue with the state. We believe that you ought to be able to sign up, pre-register, and then go ahead and register when doses are available. You should be able to register once. You should see in front of you all the places in a county or the state, if you're willing to travel, where appointments are available, and you should be able to make the appointments. Unfortunately, the state does not have that system, and so they've left everybody to produce their own systems of registration, and the county actually has to go through the state to complete the registration for our people for scheduling vaccinations. So it's not run optimally. We think there are improvements. We've asked for improvements. We're hoping that the state makes those improvements, because this is something we could get right, and the state has not managed to get this end of this equation to the point that we think it should be. We continue to have our focus in the county on limiting transmission. We've been very cautious about reopening things for that very reason. And, we are very concerned, as if you've heard from, the national health experts about the caution the CDC is urging on not opening more things up right now. We've got variants. You've got a Brazilian variant, which is very worrying, a South African variant, which is very worrying. You've got the UK variant, which is a problem, and then you add a New York and a California variant. And remember that one of the reasons we think COVID took off so quickly in this area is the massive amount of travel that occurs up and down 95 between New York and the DC area and farther south. It's kind of a conduit. So we're very concerned about transmission, and we're very concerned about the new variants because they don't respond as well to vaccines. So it's really, really important that people minimize their exposure, do everything we've been asking you to do. These variants don't go through masks any better than any of the other variants. But what they do is they are more likely to spread if you get in contact with the virus. And there's evidence that they may reinfect people who previously had COVID. We want to knock all this down as quickly as we can. So we're asking you, do not travel during spring break, Passover, and Easter. This is like the winter holidays. We've got to get through this without bringing back more cases and causing another spike, particularly if the result of travel is that people start bringing back cases with more of the New York variant and the Brazilian variant. And all these things are here. It's not like they're not here. If we start bringing more back into this community, we could very well see another spike again. We don't have enough vaccines out there to have herd immunity or anything approximating that. So I'm urging people to please extend the caution that so many of you have shown throughout this, extend it through these coming holidays. We really want to do the things we're not doing now in person next year. We want people to be safe, and we want the folks who are hearing this now and getting this message now to be around next year, to hear different messages and to have life more normal, as all of us would very much want. So please pay attention to the guidance and follow the guidance and keep yourself safe and keep the people you care about safe. We continue to urge people to get tested. We focused on this throughout the pandemic. Now we have tests. We are seeing a drop-off in testing. I think people think that with the vaccines, they don't have to worry so much about testing. It is still a critical part of our strategy because we need to know where the virus is. And because you can still get the virus, you need to know if, in fact, you're positive. Waiting for the vaccine, you can still get sick while you're waiting for the vaccine. The virus doesn't care that the vaccine's available to you. The only thing the virus is going to determine, do you have antibodies or don't you have antibodies? And if you don't have the antibodies, you are vulnerable. So don't put yourself in a situation where you don't know whether or not you're safe right now. So that's where I'll stop now, and just hope that everybody can be patient, and I look forward to your questions. Thank you.
Thank you, Mr. County Executive. Dr. Gales, do you have
Good
some
afternoon. Good afternoon and happy Wednesday, everybody. Always a pleasure to be with you all. I will keep my remarks brief. I did want to focus on one particular thing related to the Johnson & Johnson vaccine. But as always, I would just like to extend a special thank you to all of our staff who continues to work on all levels of the pandemic response. But given that our school health staff will be going back to support the schools as they reopen, I did want to take a moment to say a special thank you to all of the school health staff who quickly pivoted from providing services in the schools, the early stage of the pandemic, and have been supporting all of our efforts of response, from contact tracing, the call center, to helping support testing clinics, as well as our vaccine distribution process. Thank you for your dedication. Thank you for your input. And we certainly will continue to utilize and leverage your expertise gained as you all move back into the classroom. So I did want to just make some brief comments related to yesterday. We did put out information to say that the state would be receiving doses from Johnson & Johnson. The state will receive approximately just over 49,000 doses of the single-dose vaccine, and the county expects to receive approximately 1,600 doses. I do not believe as of this morning we had actually received those doses, but we anticipate that they will be coming in the near future. And we've been asked to hold off on putting them into circulation until later this week as the state builds up the registration system to accommodate those. I do want to clarify one thing that the county executive mentioned. The federal level is pushing out all of the doses available this week to jurisdictions, and we have been notified that because of that, it is likely that we will not receive doses next week or the following week to allow for the manufacturer to resupply those doses that have all been shipped out or in the process of being shipped out to communities today and tomorrow this week. But one of the things that I wanted to address, because we will start scheduling clinics, we already are ready to go with that and are waiting for the official green light from the state, is that there is some conversation that says, well, the Johnson & Johnson dose is inferior to the other ones, and I don't want to get that one, I want to get the other two. That's not accurate. And so I wanted to take an opportunity to clarify a few important points. Now, the Johnson & Johnson vaccine is the newest of the vaccines that have been approved to make it through the process. It also means that it has been in its clinical trials of over 44,000 individuals in the United States, South Africa, and Latin America, has been tested in a setting where we do suspect that there were an increased number of the variant strains that the county executive mentioned. And the data suggests, similar to the other two, that it has good results in protection against those particular variant strains. Now, there have been some concerns to say, well, the efficacy is 66% versus 94% and 95%, but let's take a look at the numbers a little bit differently. The Johnson & Johnson vaccine, and within the first 2 weeks of administration, was 85% effective against severe disease and 100% effective at preventing death secondary to acquiring COVID after being vaccinated. And a month after receiving that single dose of the vaccine, the data shows that there were no hospitalizations related to COVID for any of those individuals who had received the vaccine. And that's important to note because, one, it suggests that protection against the virus comes at a quicker time period, if you will, in comparison to maximize the effect in comparison to the two-dose regimen. And again, it is effective at preventing severe illness secondary to COVID-19, if one gets it, and very good about nearly 100% at preventing fatalities as well as COVID-related hospitalizations. And that's ultimately the goal of the vaccine, is to keep people safe. None of them are 100% in terms of preventing an individual from getting it. They all have met the 50% threshold that the FDA has cleared, and they are all, including the Johnson & Johnson vaccine, have high numbers, 100% again, in terms of preventing hospitalizations after a month of acquiring the vaccine and significant reductions in severity of illness, as well as COVID-related fatalities after being vaccinated. And so I just want to hammer home those points, that it's important for folks to understand that getting one versus the other is not an inferiority or a second-class opportunity. As Dr. Fauci mentioned, he would encourage individuals to take advantage of vaccines that are made available to them to provide protection and coverage. And so I just wanted to take that opportunity to clarify that for the folks watching at home. And the other thing that I would also like to mention as it relates to vaccines and open up for questions is that we have doubled down in the last week to send out registration links to our residents who have pre-registered over the age of 75 to make sure that we're not missing anyone. As the county executive mentioned, we have over 70% of those individuals who've actually completed the vaccine that we are aware of, including part of the county, the other vendors throughout the county, and potentially at other sites throughout the state and other places. We are beginning the process of moving to our next set of priority groups, including those, if you go back to our prioritization framework, those in the essential employee categories across a number of different industries, as well as those who are over the age of 65. So as we continue to move through the rest of the week, we will continue to work to, again, apply our equity framework within that and continue reaching out to our employers of those respective industries. We've had previous conversations with those industries to get an understanding of how to prioritize within those groups, again, because we don't have enough supply to cover everybody. But that is where we're moving, and we're excited to be able to, at least from the county perspective, be able to offer opportunities for individuals within those groups to align with their eligibility or availability to receive vaccines in other places throughout the county. I will stop there. Happy to answer any questions. Dr. Stoddard, I believe the floor is yours.
Thank you, Dr. Gales. Thank you, everyone, for having us back and being here. Just to give a couple of additional updates, we've been working very closely with Montgomery County Public Schools as they prepare they initiate their reopening this week and move into their next phase of reopening planned for March 15th. At this point, the partnership with Hopkins has proved is accelerating both with our public schools and our non-public schools. So far, for our public schools, I know many have asked about that, about approximately 11,570 invitations to receive a vaccination have been offered. This does exceed the 9,000 that were required for the March 15th timeline. In addition, I know that Johns Hopkins has asked the public schools for an additional 2,000 persons to be able to invite, and the county has actually asked for approximately 4,000 names off of their list as well to try and expand that vaccination effort for their April 1st and their phase 3 and phase 4. Similarly, we have already collected lists for the non-public schools, both for Johns Hopkins as well as the county health initiatives. And we'll be expanding those efforts, as Dr. Yale said, as we complete the 75 plus, we will be moving into the 65 and over, as well as some of these essential workers, including our educators. As discussed at the federal level and the interest from the Biden administration to have educators vaccinated by an April 1st timeline, we believe within Montgomery County we will be able to meet that timeline both for our non-public and our public school systems. And that's the goal that we're going to try and meet, and we believe we will meet. And so that's all I wanted to add to the discussion that we've had today. Happy to take questions at this point.
Thank you very much, gentlemen. So reporters, remember to use a chat to ask permission to ask questions and also identify the organization you represent. First question comes from Tom Fitzgerald, Fox 5 DC. Questions for the county executive and also Dr. Gales. Tom. You need to unmute, Tom. Apparently he's muted. You're muted? Okay, can we unmute Tom? There you go. There.
Thanks for doing the call, everyone. Good to see everyone. County Executive, I wanted to ask you more about this mass vaccination site that the county wants from the state. You had said earlier there are no favorite children here, but the state is announcing these mass vaccination sites. They are not here. You've expressed that you have, the ability to do this at the Agricultural Center. Clearly, it's the most populated county in the state. I'm curious as to what you're hearing about why this is not happening. Why is Montgomery County not getting this site? And I'm curious as to whether or not, there's any bad blood or anything going on here from past disputes over, you name it, 270, the schools opening or closing or whatever has gone on over the last couple of years. Yeah. What in your gut, what do you think's going on here?
I don't think it's any of that, because I will say, that the county works with the state on a number of different issues. And while there are some things we disagree about, we have really good cooperation on other things. I can talk about my housing department, working with the state housing department, our economic development group, working with the governor's people who focus on economic development. Soon you'll be hearing about something we're doing big way in economic development. We've engaged the state in. So, I've always said from the beginning that even when Hogan and I disagree, it does not trickle down to the rest of how we do business with each other. And I give him credit when I think he deserves it. I thought he took, a really important lead in this in the beginning. We began to differ as time went on, but we differed. You differ and then you go on about your business. So I've been okay with that. I think, the only thing I can ascertain is the state's tried to deal with places that have the least ability to set up vaccination facilities. And Montgomery County's clearly demonstrated that even in the absence of a mass vaccination site, we vaccinated more people than anybody else. We'd like to vaccinate more. And we have, because we do have this disproportionate number of cases, that doing things by your percentage of population undervalues the impact of having a disproportionately high number of cases. The site in Prince George's County is not a Prince George's County site. The site in Prince George's County is meant to serve us. It's in my opinion, it's way far away from the bulk of Montgomery County. So it's not even, but I will say also, apparently we're using it a lot. A site here in Montgomery County would serve parts of Prince George's County that are closer to us. It would serve Frederick County. It could serve Carroll County. So we believe, if the goal is regional centers, we're an ideal regional center. We've demonstrated the ability to do this, and now we've made it clear that if the issue is really logistics and how long it takes to set something up, when the vaccine supply increases, and all this is limited by vaccine supply, if he gave me a site and took it out of my current doses, there would be no net improvement in the county. So you got to give me new doses, but if they give us more doses, we'll set the site up. We already have a hospital partner. We can do this. We know we can do it. So don't hold back because of logistics issues. When the doses are there, give us the doses. We'll get them out. You'll be happy. We'll be happy. And our residents will be very happy.
And with that about doses, let me turn to Dr. Gales. You just laid out how many J&J shots you expect to be getting. Obviously, we know from what the president had to say yesterday about, the ramping up of production for the J&J shot. But I'm curious, what would be the net effect of opening up a max vaccine site in Montgomery County if you then don't have the doses to give out to the public who wants it?
So I think there are two issues there. We can't stand up a mass vac site if we don't have the doses to support it. That's, unless I'm missing something, that's pretty simplistic there. But I would say, so we continue to advocate for a mass vaccination site for broader appeal and availability to our residents and other folks throughout the region. At the same time, we also advocate for an increase in doses. So in supporting those mass vac sites, we don't want that to also take away from doses that are supporting other opportunities, such as local health departments, who do have, for the segment of our population who is unable to access those mass vaccination sites, whether they can't drive or whatever host of reasons they aren't able to do that, who have long-standing relationships with community partners and community venues to be able to create a more intimate system that is respectful and thoughtful around all of those local issues to address those barriers that prevent individuals from being able to access vaccines. One of the things that I would emphasize is that when we look at the percentage of folks who are getting vaccinated, and when we think about it from an equity standpoint, however you define equity and whatever factors you're using for that, we can't always run to, well, people are hesitant to take the vaccine. We also have to do our due diligence and our homework to make sure that we have interrogated the systemic factors that could drive, or put obstacles into place that prevent individuals from being able to do it, whether that's access to technology, access to computers, access to primary care and medical communities or facilities to help drive those messages. So absent of large amount of doses, it's tough to stand up and sustain a mass vaccination site. But at the same time, we also continue to promote for an increase in doses for other areas that may be able to meet some of those niche needs of our respective jurisdictions.
Thank you.
There, I was muted. Kate Ryan, WTOP, has questions for Dr. Gales and also for the county executive. Kate.
Thank you. And this may shift a bit. It may go to Dr. Stoddard as well. But in light of what you were just saying about a mass vaccination site and whether or not it makes sense to have one if you don't get the doses, I know, Dr. Stoddard, you talked about yesterday checking out the Montgomery College site in Germantown. How close are you there to actually setting that up? Your suggestion was we set up a prototype, we show the state we can do it, and hopefully we get it. And then does that really improve accessibility? I don't know much about the transit access to that site for county residents. How would that be most helpful?
A couple things. So heard from the public health team. They also I made a visit to Montgomery College Germantown on Monday. The public health team made a visit on Tuesday. I was joined by one of our hospital partners who, actually Holy Cross, who obviously has the hospital in Germantown right on that campus as well, who would be interested in potentially being our partner should the mass vaccination site be approved at the state level. But I think we want to show proof of concept. So we actually toured the locations, both from myself and the hospital on Monday and the public health team on Tuesday. I heard from the public health team that they're going to go ahead and move forward with utilizing the site while we wait for a state approval, just as we said, a demonstration that this site is functional. There are several elements about the site that are incredibly attractive that make it a very good site. There are multiple, roughly 10,000 or square foot or larger spaces that are available. Both a gymnasium as well as a sort of a conference space that they utilize for their blood drives. There are thousands of parking spots associated with that location. It is immediately off of Interstate 270, which makes it accessible both from a county transportation perspective, but also if it were a state site, available to residents from Frederick County and north of us. And so obviously it has a lot of attractive features about it. They have on-site obviously with the college being mostly remote through likely much of the fall even, there is a lot of space that is being underutilized, both not just in these primary large spaces, but also adjacent to them. It also so happens that that the Germantown zip code in which Montgomery College is located is one of our priority zip codes. And so, that is it checks a good box for us. As we talk about what's going to happen, I know that what the president said yesterday about having a dose for every adult American in the U.S. by the end of May. We need more spaces that are fully capable of ramping up, whether there's a state vaccination site or our own sites that are scalable such that when the vaccine doses increase substantially, we can do much higher throughput. So we're going to have these niche opportunities where we take vaccine out to communities, but still to push numbers, we're going to have these large sites with high throughput to balance a portfolio of vaccination options that we have. In addition, let's be real, MCPS is going back into session on March 15th at the two high schools that we are currently utilizing at Quince Orchard High School and Richard Montgomery. And so we want to have spaces where we can, separate those activities and not risk overcrowding. So, as we're ramping up our vaccination efforts, presumably with more doses coming, if the federal government's to be believed, which we believe they are, we want to be able to make sure that we have spaces that can ramp up and not run into challenges with students and other activities that are also ramping up. And so we're looking for other spaces that are more flexible to us.
Got it. And Dr. Gales, quick question for you on the Johnson & Johnson vaccine. Again, 1,600 doses expected this week. Yesterday, you were saying we're going to get them into your arms today. You've been told, do I understand? You've been told to hold off on that. Why? Why the wait to get those out into circulation?
Well, the first issue with that is we haven't physically received them yet. So that's the first challenge. We haven't actually physically received the doses yet. We were told they're coming, but we haven't actually received them. The second issue is I believe the state is working to build into the registration system, the PrepMod and the Immunet system, the infrastructure to be able to register the doses. Forgive me if that's not correct, but that's my understanding. And so we've been asked to hold off until beginning on utilizing those Thursday. Again, that's assuming that we will physically receive them, because as of this morning, we had not done so just yet.
Gotcha. And just to follow on that, yesterday you were talking about, look, you're not going to be able to choose them. And Dr. Stoddard, you made the really interesting point of when you have different varieties at a single site, that's when you could end up with, errors, and you don't want that. You want to be sure that you're getting the right dose into the right person and the right follow-up. Dr. Gales, can you talk about that? Again, the issue of you're not going to be able to choose what vaccine you get, but that people should be assured that whatever they get, it is effective. Most of them, I understand, more effective than my annual flu shot, correct?
Yes, so that's the most important point to hammer home, is that all of the vaccines are viable, they are effective, and they accomplish the goal of what we want a vaccine to do, which is to prevent severe illness and ultimately death secondary to that particular illness. They all three score very high across the board in terms of being able to effectively do that. And so what we're likely to do is, again, recognizing some of the logistical challenges with scheduling, is we're more likely going to have at the clinic sites a specific type of vaccine. And when individuals go through and register in the system, they will know which type of vaccine they're going to receive, so that when they show up, there's no surprise and there's not the ability to change. Now, if individuals do happen to see a link and say, well, I don't want that one, we want them to understand that there is a potential wait associated with that. And so what we're trying to do is increase opportunities as much as we can and increase entry points and make those available to our residents.
Got it. Thank you.
Thank you, Kate. Rebecca Tan has questions from the Washington Post, questions for Dr. Gales and also for Dr. Stoddard. Rebecca?
Thank you so much. Before I get to my questions, I just have one quick clarification. Will essential workers in Group 1B be getting an invitation this week to schedule an appointment, or is that coming up?
That process is starting now, and so that will continue, again, recognizing that we have thousands of people who fit into these categories. And again, based upon the supply that we have, as I stated in my opening remarks, we have asked industry leaders and employers within those different categories to create a prioritization framework, again, based upon type of exposures, level of exposures, folks who are coming into the office versus those who aren't, to try to give a sense of who would benefit from it most in terms of they're at risk based upon their level of exposure.
Got it, but it is starting.
Yes.
All right. And my next question, sort of jumping off what Kate asked you earlier, is for the Johnson & Johnson vaccine, is there a specific group of people that you're going to prioritize for this particular type of vaccine, or is it just going to be sort of random? Is there any kind of strategy or reasoning as to which clinics it's going to go to, if that makes sense?
Sure, that's an excellent question. And as it stands, FDA and ACIP did not put out any recommendations for one particular group to get it. Now, there was a small amount of data, which again, ACIP has not expressed concern with, that potentially it may be slightly more beneficial for younger folks compared to those who are over 60. There were some in the studies, a small amount of folks who had some lower efficacy, if you will, that when they went back to look at it, that was not a significant concern. And again, they have cleared it to be used for everyone. But the thought is that in thinking through some public health related strategies related to surveillance, that, for example, our workers who are exposed or out in public on a daily basis, they may benefit from the Johnson & Johnson dose because the protection comes at the maximum protection comes at a sooner time period versus that, over a 2 dose period spread out over a month, and potentially leveraging those doses more for our older residents who are more likely to be staying at home and having less interactions in the public setting. We're continuing to talk with our colleagues in other jurisdictions as well to try to get a sense of how other folks are using it to be uniform and standardized in that approach. There's also been some suggestions that potentially the one-dose vaccine may be more beneficial for individuals where there are concerns, for whatever reason, about their ability to come back in for a second dose, our ability to be able to follow up with them to make sure they get the second dose to maximize their protection.
Got it. And one last question, if I can take the time. We're seeing sort of the cases start to plateau in Montgomery County as well as sort of in Maryland as well as nationwide. Can you tell us who is still getting the virus and where are they getting it from? How is the virus spreading right now?
Well, I think everything clearly continues to point to widespread community transmission. Wednesdays is actually, usually we get our updated contact tracing information from the state Wednesday afternoons. So we'll be taking a look at that data, which compiles everything from the last week. And so in that time period that you've referenced with the plateauing of the data, that would be covered in the last week. And so what we'll do is take a close look to examine again to see if there's any activities that jump out. But right now it's still pretty much, widespread, or not widespread considering the numbers have come down, but the numbers and the types of activities are still indicative of community transmission.
One thing I'll add on that is we have seen pretty significant drops in both the healthcare sector as well as in our nursing home sectors. And I think that is explaining a lot of the reduction in total cases that we have seen, because those are two pools of people that are heavily tested generally. And so they have, when you see a reduction in those groups, it will drive a reduction in numbers. And therefore, because they're some of the groups that, particularly the healthcare workers, they were getting infected at a higher rate. If you drive the highest rate group down substantially, as the vaccinations have done, that has collateral impacts across the board on, not to say healthcare workers are exposing people, but anyone who's sick has the potential to expose someone else. And if you drive down the numbers in your healthcare workers by vaccinating them, then it has collateral impacts across the board, which we are seeing. And so I don't think there's been a substantial change in where people are getting infected. It's just because some of those larger categories are being protected at such a high degree, you're seeing a reduction in the total numbers more substantially.
Thank you so much.
Okay. Next question is from Caitlin Peets, Bethesda Beat, for you, Dr. Gales. Caitlin?
Hi there, good afternoon. I have a question about contact tracing in schools as we talk about more kids going back into MCPS facilities. I know we've talked at length before about how schools have to report to the health department any illnesses that present like COVID-19 and have an investigation into that. Aside from knowing that school health nurses and employees can be part of that tracing, do you foresee any logistical challenges of an expected increase in needed investigations into COVID-like illness? Have you bolstered staffing to assist with that? Has there been any discussion about that?
Yeah, so we have bolstered staff in general to, absorb any personnel, transitions, for example, with our school health staff going back to our schools, but we anticipated that and began bolstering our staff around that back in October and November. As to the question of the logistics and ins and outs of how the contact tracing process goes, so the process that we would utilize for MCPS would be identical to the process that we have had in place working with our non-public schools since back in September and October. And so we have well-oiled protocols in place in terms of notification from the schools to the disease control team and our staff moving forward to conduct the necessary contact investigations. We have, as some of you may know, Dr. Stoddard and I meet with MCPS leadership on a weekly basis, and we've discussed, providing guidance in terms of how to move forward with formal investigations, as well as, any other type of informal information to make, some quick decisions to, provide assurance and provide guidance. Some of the things that I want to emphasize again for the folks watching at home is that we do expect that there will be cases that pop up. We also want to remind folks that schools also have to report COVID-like illnesses, so there's a host of things that are going to happen, and you're likely going to hear about cases in schools, and you're likely going to report them as the media, but that doesn't necessarily mean that because there is a case reported or there is a COVID-like illness reported, that the first step will be closing the school down. Every investigation is different, and the guidance that we would provide from the public health standpoint depends on that specific case. So there may be instances where we find it's not a true case, and folks may have to quarantine until we get the final results. That could mean a classroom could be quarantined. It could mean a school could be quarantined. It would depend entirely on the particular situation.
Just one follow-up. You touched on private schools a little bit, and it's been a while since I've checked in with you about how things are going with private school instruction. As far as, cases in their school buildings, how have things been going in the last few months? Have you seen any increase or decrease in cases associated with non-public schools?
We've continued to see cases pop up, and we've been investigating them as they come up. I confess I don't have the up-to-date spreadsheet in front of me, but we have continued to see some cases, and continue to conduct investigations as needed. Offhand, I can't recall of a large-scale school closure or anything like that within the last several weeks. At least through the month of February.
Thank you. Haley Miller with Baltimore Sun has questions for either the county executive or you, Dr. Gales. Haley, are you still there? Okay, we'll come back to you. Okay, you're next, Brianna Arikuzumo from Bethesda Beat, which you have a question for Dr. Gales, I believe. Brianna.
Yeah. Thank you. I just had a quick clarification question regarding an answer that you provided to one of Rebecca's questions regarding the rest of Phase 1B. I know that you said that the process is starting now to ask industry leaders to prioritize employees based on a couple factors, but are appointment links actually being sent out to anyone in those the rest of Phase 1B, or if they're not, when would we expect that those appointments will be offered to those groups?
So we've actually been meeting with those industry employers for weeks now, anticipating that we would be moving forward because we knew the day would come when we would be able to move forward, and we wanted to make sure that we had a system in place to be able to offer vaccines as they become available. And so we are in the process of going through those lists right now to begin sending links out to folks in the very near future, meaning likely today. And so we hope to be able to start that process and get people in. And again, let me just level set expectations for everyone at home. We do recognize that lots of people fit into those categories and have pre-registered. That's thousands of people. We have limited doses, and so everyone is not going to get a link today, and it's going to take some time, and we do ask folks to continue to be patient as we roll doses out. We also want to continue to emphasize that individuals in 1A, 1B, and 1C have been for the last several weeks and continue to be able to seek vaccines at any of the other county sites that are available, as well as the mass vaccination sites throughout the state. We do recognize that they have limitations as well in terms of appointments offered, but we just want to make sure that folks understand they do have options within the limited supply that are available.
Do you have sorry, I think Dr. Stoddard, you were.
Yeah, I was going to say, in terms of numbers here, just for 1C, tier 1 alone, then 65 to 74-year-olds, that's 90,000. In tiers, in 1B, tier 2 and 2 and 3, our essential workers, there are, let's say, 25,000 or more MCPS employees and staff. There are 7,000 to 9,000 non-public school staff. There are 15,000 or so childcare workers. There are about 1,500 in our essential emergency food providers. There are over 1,000 in our transit workers when you include both county as well as our, the Montgomery portion of the WMATA workers, for example. That's not even, we haven't, we're still working on the numbers for grocery stores and for postal workers and agricultural workers. And so suffice it to say, there's 150,000 or more people in the groups that we're opening up to this week. And as we've talked about, we're 4,500 to 6,500 doses a week right now. And so, yes, some of those people are being vaccinated through other means. The county doesn't have to do all 150,000. which is understand that this is the largest group that we have opened up to date, and therefore we're going to be in this phase for a while.
Gotcha. Well, you must have read my mind because you just answered my second question. So thank you.
Okay, the next question comes from Jacob Fenston, WAMU, and it is for Dr. Gales.
Yeah, thank you, Dr. Gales or County Executive. I was just wondering about the numbers of Johnson & Johnson doses. I think you said 1,600, and I was curious because that seemed low out of the 49,000 the state is getting, and so I just did a little, math here, and it looks like the county, if that was divided by population, the county would be getting something like 8,000 doses. So can you explain what the how that's being allocated?
Well, you'd have to ask the state for a full official, breakdown of how they're allocating. But, we do suspect that all of, that 49,000 is being split amongst hospitals, health systems, potentially retail pharmacies in those spaces, as well as the local health departments. So while I can say that we're getting 1,600 as a local health department, I don't know how many other Johnson & Johnson doses will be coming to the county in those other spaces through the hospitals or retail pharmacies, those kinds of things. I would say the state want to have more information on that, to determine, how it breaks down by, population size within that. I hope that answers your question.
Yep, thank you.
Thank you. We have one more follow-up question from Kate Ryan at WTOP. Kate, do you want me to read it or do you want to ask it?
I'd like to ask it. Thank
Okay.
you. Again, if I'm a 75-year-plus person, I go in, I get my first dose, and then I get the invitation for the second shot. Am I guaranteed that spot? There seems to be some concern about whether I get an invitation and then have to book that on my own again. How does that actually work?
Yes, so once you get that first shot, you're guaranteed your second shot, but it does require you, and I can speak from when I did mine, I got a link to say, "Hi, Travis, you are due for your second dose. Please go and register for your appointment to get it." So you do need to go back and schedule that appointment. It is not an automatic to say, I came in. Unfortunately, the system doesn't work that way. I came in today. I can, automatically get a clinic time a month away. You do, as it currently stands, you do have to go back in and schedule that second dose. But that said, once you get that first dose, that triggers a note in the state system. So the second doses that are sent to us are based upon the number of people who are coming through the door that we provide the first dose to.
Got it. Thank you.
And we have one last question from Jack Moore, also from WTOP. Jack?
Yes, thank you. And apologies if you've answered this. My brain might not be working, but is the county doing phase 1B tier 2 and phase 1C? Is this kind of one effort that you're doing, or are you starting with phase 1B tier 2 and you'll do that for maybe a week or so and then move to 65 plus? Or is it possible that people 65 plus phase 1C would be getting appointments, starting this week?
So we're moving forward to include the rest of 1B, which would be those essential employees, and to also begin including those who are 65 and up.
Thank you.
Okay, and with that,
Lorna, I saw in the chat, I know it's not from a reporter asking about childcare. We can just address that quickly. We discussed that this morning. I think you should expect to hear from more on this later this week. We're not ready to announce anything yet because we haven't finalized it. It would require an executive order modification, but it's being discussed, and I would anticipate that you'll see something on this by the end of the week.
Thank you very much for addressing that question from a county resident. I think with that, we're done. No more questions from the members of the media. Going once, twice. Thank you so much for joining us today. Everyone, stay safe and have a great afternoon. We'll see you next week. Take care.